The most effective way to prevent STIs and unintended pregnancies is by abstaining from sexual activity. Delaying sexual activity until you are ready and in a mutually monogamous relationship can greatly reduce the risk. Avoid using alcohol or drugs before or during sexual activities, as they can impair judgment and lead to risky decisions. Clear communication and consent are vital, and they're harder to ensure when under the influence. Engaging in risky behaviors, such as sharing needles or engaging in unprotected anal or vaginal sex, increases the likelihood of contracting STIs. Avoid these behaviors to protect your sexual health. Consent is crucial in any sexual encounter. Both partners must give clear and enthusiastic consent before engaging in any sexual activity. Remember, consent is ongoing and can be withdrawn at any time. Effective communication is key to sexual health. Feel comfortable discussing sexual health, concerns, and boundaries with your partners and healthcare provider. Open conversations promote understanding and help ensure safer sex practices. If you choose to have sex, always use a condom correctly and consistently. Condoms provide a barrier against STIs, including HIV, and can also help prevent unintended pregnancies. Make sure to use latex or polyurethane condoms, as natural materials like lambskin do not protect against STIs. Starting around the age of 21 or as recommended by your healthcare provider, consider getting regular pap smears or HPV tests to screen for cervical cancer. These tests can detect abnormal cell changes in the cervix early on. Stay informed about sexual health and safe sex practices. Seek accurate and reliable information from trusted sources like healthcare professionals, reputable websites, and educational materials. Being well informed empowers you to make responsible decisions. If you are sexually active, consider using additional methods of contraception alongside condoms. Talk to a healthcare professional about birth control options like the pill, patch, vaginal ring, or intrauterine devices to help prevent unintended pregnancies. Remember, birth control methods do not protect against STIs, so condoms should still be used. Explore various contraceptive methods with your healthcare provider to find one that suits your needs. Options like birth control pills, patches, vaginal rings, intrauterine devices, or hormonal implants can help prevent unintended pregnancies. Discuss the benefits, potential side effects, and any necessary precautions associated with each method. Get tested for STIs regularly, even if you don't have any symptoms. Many STIs can be asymptomatic, meaning you may not notice any signs. Regular testing helps ensure early detection and treatment if necessary. You can visit a healthcare provider, local clinic, or use home testing kits, depending on what's available in your area. Talk openly and honestly with your partner about sex, boundaries, and expectations. Make sure both of you are comfortable and consensual before engaging in any sexual activity. Maintain good menstrual hygiene by using appropriate sanitary products and changing them regularly to prevent infection or other complications. Familiarize yourself with proper menstrual hygiene practices. Be aware of emergency contraception options like the morning after pill or copper reed insertion after unprotected sex or contraceptive failure. It's important to understand how and when to use emergency contraception effectively. Remember that sex is not only about the physical aspect but also emotional well-being. Engage in sexual activities when you're emotionally ready, and make sure your partner is respectful and supportive. Both partners should get tested for STIs regularly, even if they don't have any symptoms. Regular testing is important for early detection and treatment. Many clinics offer free or low-cost testing services. Schedule regular visits to a gynecologist or a healthcare professional who specializes in women's health. Regular checkups help monitor your reproductive health, screen for any potential issues, and discuss contraceptive options. Reducing the number of sexual partners can decrease the risk of exposure to STIs. Engaging in monogamous relationships with partners who have also been tested and are free of STIs is a good strategy to minimize risk. Be cautious when engaging in online sexual activities. Never share personal information, pictures, or engage in sexual conversations with strangers online. Report any suspicious or inappropriate behavior to a trusted adult. Thanks for watching. Don't forget to like, comment, subscribe,